healthcare sector in Australia and those members who are part of the Climate and Health Alliance are calling for net zero emissions in the healthcare sector by 2035. So that's what the science tells us we need to do. So there's a lot that we need to do in a very short time to decarbonise. The good news is that the solutions are available to us. And there's already a lot of action going on to bring about change towards net zero. But we do need a coordinated response. And fortunately, our colleagues at Healthcare Without Harm have developed a global roadmap for healthcare decarbonisation. So they did a study a few years ago, first of all with the World Bank on climate smart healthcare, and then a couple of years later they developed what was called the global footprint of the healthcare sector globally, which found that the healthcare sector globally was 4%. They've since worked with Arup to develop a decarbonisation roadmap which identifies how to get to net zero, how the health sector specifically can get to net zero. They've identified 7 high impact actions for the healthcare sector to take in order to get to net zero. All of these things need to be done simultaneously. It's not as though we can do them in sequence. They're all quite different, but we need to do them together. So those are that we need to power healthcare with 100% clean, renewable energy. So that's going to involve installing solar, it's going to involve power purchase agreements with wind farms, but we can't get to net zero without the health sector being powered by 100% renewable energy. We need to invest in zero emissions buildings and infrastructure. So we need to be designing and building net zero emissions buildings, and we need to be making sure that we're adapting our existing buildings and reducing emissions within those. We need to transition to zero emissions sustainable transport. So transport in the healthcare sector is quite a considerable footprint because of our emergency services, ambulances, but also the fact that healthcare is a 24-hour operation, and many people are travelling around the clock, and therefore they're using vehicle transport. So we need to be moving to zero emissions and sustainable transport. We need to be providing healthy, sustainably grown food and supporting climate resilient agriculture. We need to incentivise and produce low carbon pharmaceuticals. So the pharmaceutical supply chain is a huge impact on the health sector's carbon footprint. So reducing the carbon emissions in our pharmaceutical supply chain is critical. We need to implement circular healthcare and sustainable waste management processes. So we need to be looking at the supply chain of products, looking at what we can do to get those suppliers to be carbon neutral and ultimately to net zero. And we need to establish greater health system effectiveness. So that means that we need to be making sure that the healthcare that we deliver in our healthcare systems is necessary, is quality care, and that it achieves the desired effect. So research shows that a considerable portion of healthcare is either unnecessary or doesn't deliver the intended outcomes. So one of the ways in which we can reduce emissions in healthcare is to avoid those models of care or procedures that are not needed, and keeping people well. So investing in prevention and keeping people out of hospital is a critical way of reducing emissions in the healthcare sector.